Hello, everyone. My name is Jason Berry with Digital Health Wire, and I'm excited to be in Las Vegas at Health 2024 with Ed Liebowitz, the Chief Strategy Officer at Solera Health. Ed, it's great to be talking with you today.
Great to talk to you today, Jason.
So, Ed, the talk on the strip is that Solera has a new total cost of care report coming out that looks into some of the potential savings that we can see from shifting more care from in-person settings to virtual settings. Can you share a little bit about the report and kind of walk us through some of the more exciting findings that you turned up?
Sure, yeah. So we partnered with a great analytic firm called Health at Scale, and we really wanted to see what would happen with our full comprehensive virtual delivery network in terms of total cost of care impact. So when you think about other studies that have been conducted, it's been, how does this diabetes management program or how does this cardiovascular program impact cost of care? And no one's really looked at what does a comprehensive network do against total cost of care. So we took our 9 condition categories, which include about 35 point solutions, ran that against a 50 million person claims data set, and really found some compelling pieces of information on how cost of care was reduced. At the end of the day, we demonstrated a 300 basis point reduction on total cost of care for that claims data set.
That's fantastic. And as you were kind of unpacking that data, was there anything that turned up that either surprised you or maybe challenged some common misconceptions that people might have about shifting some care to virtual settings?
Yeah, a couple things, great question really popped out to us. One was that when you look at the virtual delivery system against brick and mortar over an annual basis, you see that in a virtual delivery system, patients get to a baseline steady state much faster than they do with brick and mortar. And brick and mortar, you can kind of see, punctuated equilibriums at time, and total trend starts to go up at the end of the year because of adverse events that are happening. And then secondly, what was really interesting that I think, some of the industry has been talking about for a while is that wellness solutions have a different form of ROI than some of the more virtual specialty solutions like an Ochi Health, an 9am, or Voria that are coming out, where transitioning that site of care from a expensive specialist visit with imaging into a virtual system introduces really immediate savings, where the disease management programs like a diabetes or a hypertension program take a little bit longer to deliver ROI. And we thought that the data was really compelling as you look across the entire system versus, again, just one point solution at a time.
And why do you think that virtual care is optimal for having this shift? Why do you think it's moving the needle so much?
Yeah, I think there's a couple things. I mean, if you look at some of the studies for digestive health, for example, if you go see a GI, you're going to get a colonoscopy or an endoscopy, right? It's just doctors tend to focus on imaging, right, to get complete information. Where virtual care is combining a specialist visit with a multidisciplinary care team, and the economic model is set up such that you're actually paying attention to what's driving the individual symptoms rather than just diagnosing them based on some labs or imaging. So that comprehensive approach can really transform how care is delivered, especially when you can connect the dots between all the different care modalities.
Perfect. And for anyone in the audience who might not be familiar with Solera and the work that you're doing, how are you helping your customers realize some of these total cost of care reductions?
Sure, yeah. So for folks that aren't familiar with us, Solera was founded in 2015. The Affordable Care Act said that folks that were on exchange-based plans or Medicare Advantage needed to be offered diabetes prevention. At the time, local community-based organizations were offering those programs. They had no ability to file payments or bills with insurance companies or file reports with the CDC. Solera creates this technology that allowed folks to navigate to available class within a geo radius of them, but more importantly, ingest the data from those community-based organizations, translate that into an 837 or a healthcare claim, and be able to bill like United Healthcare for it. Fast forward, we now have 9 condition networks based on that premise of navigating folks to appropriate care. Each of our condition networks have multiple acuity or intensity levels, so we navigate folks to the level of clinical support that they need. But most importantly, we ingest data from all those point solutions, standardize it as a FHIR data variable, bill on benefit, and then can basically connect the dots between the traditional care system and the digital healthcare system to really deliver that virtual delivery system and ultimately reduce the total cost of care.
Fantastic. And I know it's only Sunday at the trade show. We're just getting the ball rolling here. But what are some of the major trends or some of the chatter around
Yeah.
the exhibit hall? What are you hearing on the ground?
Yeah, I'm talking to folks all day, every day, as part of my role. And I think what's been really exciting is if you look at a couple years ago to now, a couple years ago, technology vendors felt like they had to do everything. They had to be everything to everyone, and people are really scared about saying, this is what we excel at, and this is what we need to focus on. And now the ecosystem is coming together and saying, we're really good at this. We're a really good engagement platform, or we're a really good virtual specialty program, or we're a really good data hub, right? And it's allowing partnerships to be much more impactful, and it's letting the health plans and employers kind of build their own partnership models so that they're impacting total cost of care and not really stacking vendor cost upon each other, because they're getting sold a bill of goods that frankly, all of us were trying to figure out where we were, and now I think we know where we are, and it's much easier to get to where we want to go.
And as we keep heading into Q4 here and into 2025, what are some things that our audience might be able to keep a lookout for coming from Solera specifically? What are some of the things you're excited to be building?
Yeah, we're really excited about the potential that AI has for our business, to improve targeting models, to be able to navigate folks through large language models and chatbots. We're tremendously excited about a few condition categories that we'll be launching in the future, getting into oncology, potentially autoimmune, and a few other specialty conditions. And then really excitingly, enabling bi-directional data feeds between the health plan and our systems, to connect the dots at the health plan, so care management can be delivered more impactfully, so that the health plans have comprehensive visibility into whatever that person is doing, be it virtually or brick and mortar, and connecting a digital delivery system to the traditional delivery system.
Well, fantastic. I'll be excited to see that as well and get it in Digital Health Wire.
Awesome.
Ed, it's
Thank you,
great
Jason. It
chatting.
was great.
Signing off from Las Vegas at Health 2024, my name is Jason Berry, and this has been the Digital Health Wire Show.